someone get an ambulance and report back to us. Can you hear me? Can you hear me? Open your eyes if you can hear me. What's your name?
Squeeze my hands if you can hear me. No response.
1, 2, 3, 4, 5, 10, 15, 20, 25, 26, 27, 28, 29, 30.
G'day mate, my name's Michael White and I'm here with this team of lifesavers from all the way down under in Australia. And we're here thanks to the Australia-Japan Foundation, the Japan Lifesaving Association and Surf Lifesaving Australia to introduce a new event to Japan called Patrol Competition. So this event started as part of Surf Rescue Competition, which kicked off with a competition called First Aid Competition, and that was in 1981. And then after that, Surf Lifesaving in Australia felt that it was important to show and demonstrate to the public the skills that we use on the patrol to protect them. So then in 1985, it was Surf Lifesaving Queensland on Australia's east coast that introduced this patrol competition. And there were quite a few competitors in that, and it seemed to be a very popular event. And then in 1987, it was introduced Australia-wide. And at that event, that was at Australian Championships held in Perth in Western Australia. We had 11 teams compete in that, and that was won by Currumbin, who then went on to win for a number of years after that as well. And it's only gone from strength to strength since then. Out of our 311 clubs around Australia, we now have close to 100 that will participate in surf rescue competition to some extent. And clubs find that it's great to retain membership as well as to improve members' patrol skills and develop leadership qualities in young members so that they can become our future patrol captains on the beach as well. So the patrol competition event in Australia involves a team of 6 members, and within that team you then compete in certain elements to test all of your abilities as a lifesaver. So the first of those is you do a theory paper, and in that theory paper there are questions that relate to surf lifesaving practices, and they test people's knowledge about treatment to provide to people, rescue techniques and patrol operations, and everything they need to know to be a good lifesaver on the beach. So those are 20 questions, and those are allocated points. And throughout the day, during the event, the team who accumulates the most points in each of these segments wins. So the theory component is the first one. The next one is that there are physical races. So one of those is a surf team. And that's just like the other surf teams that you do in surf sports competition, except that there are all 6 members who compete in that, not just the 4 as you would have in a normal surf race. And there's another event as well, which is called the Board Tube Rescue Relay. And in that event, a swimmer swims out to the can and raises their hand, just like they would in a board rescue. And then a competitor goes out to the can to rescue that person with a rescue tube and swim fins. And then they raise their hand, and a board paddler comes out to pick up the original swimmer. And it's the first team across the line that is awarded the most points. So those are the physical events. Then there's also a resuscitation component, and that's broken up into 2 parts. Live assessment, so that's where a patient is simulated to be unconscious, and 2 of the members will then go in and provide treatment to that person. And that's doctors A, B, C, D is what we call that in Australia. The second component is CPR on a mannequin. So that's designed to simulate resuscitation on an unconscious patient who isn't breathing normally, and that involves use of oxygen and a defibrillator. And then the final part of the event is then what's known as the patrol scenario. And in that patrol scenario, the team attends the beach as they would for a normal beach patrol. Members are allocated roles within the team for what they need to do. And then the team is presented with scenarios that replicate incidents that they might encounter on the beach. And here it's designed to test their proficiency as a total patrol and how well they work as a team. So you could have things like a swimmer in distress, or you could have a first aid incident, like a person with a cut to their leg. But all of these events happen very quickly, and it's designed to test how well the team can adapt to the situation and how well they can work together to provide the best possible care for those people. That's allocated the most number of points, and that's considered the most important part of the event. But when you've done all these events across the space of a day, the points are accumulated and tallied, and whoever has the highest amount of points at the end of the day is the winner. And that's how patrol competition works in Australia.
I'm going to talk to you about the resuscitation component of the patrol competition. The first section is the live patient assessment. There are 2 team members who participate in that section. So initially we assess the patient and we want to check for danger to begin with for ourselves. So we want to ensure that we're not going to be put into more danger to help this patient. We then check that there's no extra danger for anyone around the scene, and then we check that there's no danger from the patient as well, or to the patient. If that's all clear, then we check the patient's responsive, so we check that we can wake them up or not. So we initially talk to them, then we squeeze their shoulders and check that if they can sort of understand what we're saying through a bit of checking their response. And if they can't talk, we get them to squeeze our hands just in case there's a reason that they can't talk. So we try and a few different sort of steps to try and get a response out of the patient. So the third step after response, if we find that there is no response with the patient, we need to send for help. And when we check the airway, we check it on their back first. We look into their mouth, open their mouth up, look into their mouth, see if there's anything in the airway. If there is, we'll take it out. If we need a further look, we can tip the head back a little bit and look further deep into their throat. And if there is something in their throat, then we want to roll them onto their side to clear the airway. So we use 2 people, roll them onto their side, being very gentle with the patient, and then drain their mouth to make sure anything falls out, drains out, and then we can also clear with our fingers to clear anything else that's in the airway. After we've checked the airway, then we check for any breathing. So there's 3 steps to that. So we look at the rise and fall of the chest. We listen for any air coming out of their mouth, and we also feel for any breath coming out of their mouth on their cheek. And the other operator can also feel for any rise and fall of the chest or abdomen as well. If there's no breathing, then we need to commence CPR. So we roll them back onto their back, give 2 rescue breaths to the patient, and then we start the compressions. That sort of ends the period of the compressions part. We do the next compressions on the mannequin section, but if the patient was to regain consciousness after those compressions, then we roll them onto their side again, ensure that we keep good drainage in case they vomit or regurgitate any fluid, and drain it out of their mouth. And then we keep checking for their breathing and monitor their vital signs and signs of life as well. So we monitor their response and their breathing and their circulation as well. So that generally concludes the live patient assessment. So a few points that I would like to sort of suggest to help you with the competition would be to do everything slowly and step by step. It's sort of move through nice and slowly, and you sort of narrate what you're doing as you're going along. And then I would also say that you need to be very precise and gentle with all of your movements. So in your pistol grip and holding the head and then tilt it back, and then you sort of do everything very slowly and precisely. So you roll very gently, because there are marks for rough handling as well. So just a few little points there. So the second section of the resuscitation component of the patrol competition is the resuscitation on the mannequin. It involves 4 members of the team. The first member comes in and they do 1 person CPR. So they do 30 compressions and 2 breaths within 2 minutes. And you need to try and get your timing for that in between 1 minute 55 and 2 minutes to lose no points. If you go faster or slower than that, then you'll get marked down. So each round of the compressions is timed. You also again have to be very gentle with each of those movements, and you try and do each section, each set of compressions and each set of breaths on a similar time schedule so that you have the right, so you can get sort of a consistent rate along each of your compressions. You also need to ensure through each compression is the same depth, and each breath is the same amount of breath as well. So you can get marked down for being inconsistent with your breathing and your depth of compression as well as the timing. After the first person gets to 4-4 with their breathing, then the second team member comes in. They introduce themselves and say that they're going to take over the compression segment and that it's going to be a 2-person CPR. You introduce yourself because they're trying to simulate what it would be like in a real life patrol scenario if you weren't aware of what each person was capable of doing. And so one person, it might just be on a beach patrol and one person's there just doing the CPR, and then another person comes in and says, oh, I know how to do this, I can help you. I'll take over after you finish this one. Once number 2 starts the compressions, that signals number 3 and number 4 to come in. Number 3 is the defib and number 4 is the airbag operator. So number 4 say that they're introducing the airbag and that they'll introduce it into the sort of scenario. She will check everything in the defib is working and then apply the pads on, all while the rest of the scenario continues. And all throughout, you all need to be coordinated. You don't really talk about who's doing what next. You sort of just say the scripted, I'm going to take over compressions at the end of your next cycle. And you also need to ensure that, again, you're very, very gentle with the patient, very precise with your movements, and that your timing is consistent over each section. So the compressions need to be the consistent depth and the consistent rate. Breathing needs to be consistent depth and rate, and the timing also. Then as soon as the compressions start for the 3rd round of CPR, that's when the defib operator says, analysing, staying clear, and everyone has to stop. So they're saying, staying clear, this defib needs to analyse to see if the patient has a shockable rhythm as to whether they need to be defibrillated or not. And then once everything's clear, they confirm that the conditions are safe. Then they say, shocking the patient, everyone clear, and then they check that everyone's clear, and whilst looking around, they press the button. So you don't look back at the button on the defib, you've got to make sure that you keep checking that everyone's safe, because if they touch the patient, they get zapped as well, and then you'll get marked down. So yep, and then once the patient's been shocked, they confirm that you can recommence CPR, and then you go back into that 3rd cycle of CPR, which is timed. Do that for another 2 minutes, so that has to be again in between 1 minute 55 to 2 minutes. And then after that's finished, then the official or the assessor says the patient now has signs of life and is now breathing normally, and the person who was doing the compressions, number 4, says the patient now has signs of life and is breathing normally, so they'd repeat what they said. You also have to make sure you say those things so you get a mark as well.
I'm now going to talk to you about the most important part of patrol competition, and that's the scenario. So the scenario is where a team is presented with a series of events that they need to respond to as if they were on patrol, and it consists of 3 main parts. So the first part is what's known as the setup, and teams are allowed 3 minutes to set up the beach and prepare it so that the conditions are ready for the patrol. So that involves things like the patrol captain allocating roles for team members to conduct during the scenario. It involves setting up a flagged area and checking the gear and equipment to make sure it's all operational, and then ensuring that when the scenario does start, members are ready to jump in and effect rescues and first aid treatments when they present themselves. And they need to do all of that in a very time-pressured environment, and whilst making sure that their members are also properly looked after, and that other members provide adequate support to them. So it's a very important role for the patrol captain. Here in the scenario, I'm allocating roles to Trent, and I'm asking him to go and check a tube and confirm it's operational, and then go down to the water's edge to make sure that the water is safe, because we want to make sure it's safe before we let the public go into it. I'm also then asking Kate and Tammy to look over our gear and equipment, and in particular our first aid kit, our oxyviber or oxygen, and our defibrillator, because we want to make sure that those work before we can start and open the beach. And then I'm asking Brad and Bridget to check the rest of our equipment. We need to make sure it's safe and operational, and that if we need to call on it in an emergency, it's going to do its job. So those are the main things that we do during the start of the scenario, and during that 3-minute setup time. In addition, I'll also ask Kate to conduct a sweep of the beach, which means looking around for anything that might cause any difficulties or dangers to the public. And then she goes into an elevated position with binoculars, so she can look out and see further out into the ocean, just in case there are any hazards there that we haven't identified before. By the end of the 3 minutes, it's important to have members on the water's edge where they can communicate with members of the public and see what's happening between the flags. And then it's also important to have members who are close to the patrol area, so that when they're there, they've got immediate access to the first aid equipment, and that they can ensure that all of the patients are cared for in a central location. That makes it more effective for us as a patrol to be able to look after multiple patients. The next part of the scenario is 9 minutes, and that's where all the action really happens. That's when the beach is considered to be open for the bathing public to come and swim, and then the team is presented with situations that they're not prepared for. The object of a scenario is that teams will be in isolation before the scenario, so when they come out onto the beach to set up the patrol, they don't know what they're going to be faced with. What happens from there is that swimmers can sometimes get into distress, or you can be presented with first aid treatments or other emergencies that challenge how well a team can work together and how well a team can demonstrate their life-saving skills and their ability to keep people safe when they go to the beach. So the first thing that happens here is we have a person get into difficulty in the shallows, and they've suffered a fin chop to the top of their head. So at this point I ask Brad and Bridget to go and provide some assistance to that person. They go down and carry the person up using a 2-person carry, and on their way past I need to get some important information from them. And that information are things like the patient's age and their gender, whether they're breathing and conscious, whether there's any external bleeding, and whether we require an ambulance to come to the beach to help us to provide that treatment to them. So they provide me with that information, and then it's important for me to be able to radio that into the communication centre, and that communication centre can then assist me in getting an ambulance to the beach. The person who I'm talking to on the radio is actually an assessor for the scenario, and the person who we get to do that is generally someone who actually works as a radio operator in our communication centre. So they know the important things that I need to say to them, and they also know the important things that they need to hear in order to be able to get me an ambulance or the police. So it's important that I speak well and that I communicate all the necessary information, because I'm going to be marked as that, as a patrol captain. What we then encounter is a patient who suffers a dislocated shoulder. So for that patient, I send Brad and Bridget again, because when a patient returns to the first aid area, I want to make sure that my best first aiders can continue to provide treatment there. So Brad and Bridget assist that person up, and they provide me with further details that I then radio in to our communication centre. After that, we identify that a patient is in distress out the back. So I send Trent out to do that rescue with a rescue board. When he's out there, he provides an assistance required signal, which indicates to me that he needs someone to meet him on the water's edge when he gets back to shore. So I ask him to return to shore, and when he does, I make sure I have Brad there waiting at the water's edge to help him carry this patient up to the top, into the first aid area to get their treatment. On their way past, Trent and Brad know the questions to ask this person to provide information to me so I can get an ambulance to that person. And it's important that they get this information as soon as possible, because what happens with this patient is they soon go unconscious. And if they hadn't asked this information while the patient was conscious, we wouldn't be able to provide them with the proper care that they need. So this all happens very quickly. So it's important that as a patrol captain, I'm allocating my members accordingly so that they can act fast enough to be freed up and move on to the next thing, but also to make sure that we don't get into a situation where the number of rescues exceeds the capacity of the lifesavers. But as a patrol captain, after 3 things having gone wrong at the beach, I decide it's time to close the beach. So at this point I ask Brad to go and drop the flags to indicate to the public that it's no longer safe for swimming at the beach. I also ask Bridget to go down to the water's edge with a loudhailer to signify to the members that it's time to leave the water because the conditions are no longer safe. While all the members are up providing treatment under the tent, we have a final incident, and this one is a person who's suffered a sprained ankle in the shallows. So I send Tammy down to provide some assistance to that person and to come back to me with information about their condition. When it becomes clear that Tammy's going to need to carry this person or at least assist them back up to the tent, I ask Bridget to stop the treatment she's providing with one patient and leave that patient under the care of Trent and Brad. And Bridget then goes down and assists Tammy to return that patient up to the tent. It's critical that we have all of our patients together at this point, because that allows us to better maximise the resources that we can use, like our first aid gear and equipment, our oxygen, and our defibrillator. So we provide defibrillation treatment to the patient who's been returned to shore by Brad and Trent. And at this point it's important that as patrol captain, I'm staying in a very central location and watching the water. I need to watch the water because it's important to ensure that no one goes into the water after we've identified that the conditions are no longer safe. But it's also important that I'm able to receive updates from my members as to how their treatment is going, because I need to pass this on to the communication centre to ensure that when the ambulance arrives, it's up to date and it knows just what we've been doing with these patients. So at the end of the scenario, almost all the members are in a very central location and talking to one another. And there's a point where Bridget actually needs to finish with a patient and move to another patient to ensure that sufficient treatment is provided to the patients who have the highest priority of care. Then the final part is a final 3 minutes known as the pack up. So during that period, it's important for the team to come together and collate all of their paperwork that they've prepared during the scenario, so that they can keep accurate records and ensure that members or patients who have received treatment can be passed on to the ambulance or other emergency care. And then also ensuring that all the gear and equipment is returned ready, just as you would at the end of a patrol, to ensure that it's available for the next day's patrol. Kate, who has been in the first aid area providing most of my first aid treatment, provides me with details of paperwork associated with the patients and the treatment that has been provided to them. And at the same time, I radio our communication centre to tell them that we are ceasing routine patrol operations for the day, but that we're going to continue to provide treatment to our patients until the ambulance arrives. At the end of all this, we have a talk together as a team to make sure that the members are comfortable with the treatment that they've provided, to take any feedback on things that we need to take into account in future patrols, but also just to make sure that our members are okay, given that they've experienced some traumatic situations during the course of the patrol. And then at the end of 3 minutes, the event's over. And it's a big relief for the team because they've done a lot of work, but it's also a great feeling of accomplishment for everyone as well, because we've been faced with some really challenging situations, but it's great to know that after every scenario we do, we know that we're improving together as a team to be a better group of lifesavers. So in addition to being the captain of the Australian patrol competition team, I'm also the Australian Open Men's Champion Lifesaver. And Champion Lifesaver is an individual version of patrol competition. It's an event that has a really proud history in Australia, and it's been running for almost as long as patrol competition. But success in patrol competition and Champion Lifesaver really just requires the same skills, and those critical skills are wanting to improve your performance as a lifesaver. It means that you need to be very balanced in your training to ensure that you're not just good at the athletic components of lifesaving, but also the first aid and resuscitation components, and also that you stay up to date with respect to changes within surf lifesaving. Every success that you have in an event makes you a better lifesaver when you go on patrol, and you're there looking out for other people's lives. So it's important, particularly in patrol competition, to make sure that you look after your team, but also that you have fun doing what you do, because if you enjoy it, then naturally you're always going to be more successful.
私たちはパトロールコンペティションという競技をぜひ日本に大会として運営したいと思っています。それは何よりも日本のパトロール技術を向上したいからです。私がオーストラリアに初めてライフセービングを学びに行ったのが30年前です。そこでは1日のパトロールをぎゅっと15分に凝縮して、それをスポーツとして、そして競技として行っていて、その大会でチャンピオンになったチームは1年間オーストラリア中のライフセービングクラブから評価称賛される、その競技を見ていて非常に衝撃を受けました。ぜひこの競技を日本に輸入したい、そんな風に思いました。
I hope that you enjoyed hearing more about patrol competition, and I hope that you feel that it's something that can contribute to make you a better lifesaver. We certainly think that it has worked that way in Australia, and we hope it's the case in Japan as well.